Hi, everyone. Welcome to the Private Well Care Before and After Storms webinar. My name is Yiling Zhuang, the Water Resources Regional Specialized Agent in UF IFAS Extension Central District. Today, my partner, the Water Resources Regional Specialized Agent in Northwest District, Dr. Andrea Alberton, will teach this webinar with me. This webinar is part of an extension program called the Florida Well Owner Network. If you have not heard of extension before, you may wonder what extension is. Extension is a partnership between state, federal, and county governments to provide science-based, research-based knowledge to the public. There is at least one extension office in each county. I am the regional specialized agent in Central District, which covers 11 counties in Central and North Central Florida. It is highlighted in orange on the map. Dr. Alberton is the regional specialized agent in the Northwest District, which is highlighted in yellow. There are a total of 5 districts in the UF IFAS extension. As I mentioned earlier, this webinar is part of the Florida Well Owner Network. What is the Florida Well Owner Network? The Florida Well Owner Network program is an extension program that aims to educate residents about well water quality and quantity and the best practices to ensure well maintenance and groundwater protection. To facilitate access to well water testing and provide information about treatment options if problems are found. To complement efforts by the Florida Department of Health and the Florida Department of Environmental Protection to increase awareness among Floridians about best practices regarding wells, septic systems, and drinking water quality. Why did we develop the Florida Well Owner Network program? Let's first look at the private well situation in Florida. An estimated 2.5 million Floridians rely on private wells for home consumption. This translates to about 12% of the state population. Different from public water supply, private well users control the management and protection of their well water. U.S. Environmental Protection Agency, US EPA, safe drinking water regulations do not apply to residential private wells. Private wells in Florida are under the purview of the Florida Department of Health. They usually issue the permits for new construction and repair, as well as provides information to well users. In some parts of the state, the water management districts issue the well permit. The Florida Department of Health has a program called the Well Surveillance Program. It identifies and monitors threats to the drinking water supply, ensures that contaminated sites posing the greatest risk get cleaned up first, and prevents long-term consumption of contaminated drinking water. These threats are usually man-made contaminants, such as EDB. Very limited public data exists on how many well users regularly test their water or drink from contaminated well. On the other side, private well users are usually septic system users. Nearly 1 in 3 households in Florida depends on septic system for their household wastewater disposal. It is estimated that more than 2.5 million septic systems are in use across the state of Florida. The Basin Management Action Plans identify septic systems as a major source of nitrogen to impaired water bodies. There is a need to educate private well and septic system users about the best management and maintenance practices and groundwater protection. In this webinar, Dr. Alberton will first give an overview of the major impacts of hurricanes and how they impact private wells. Then I will talk about what you should do if your well is flooded and what you should do if your well testing results reveal bacteria contamination.
Hi, everyone. As Dr. Zhuang mentioned, I am Andrea Alberton. I'm the Regional Water Resources Extension Agent in the Northwest Extension District of Florida, which covers the Florida Panhandle. So in terms of storms that can affect wells and private wells, we really need to be aware of the Atlantic hurricane season. And it is officially set from June 1st to November 30th of every year. It's important to be well prepared before the season starts, and definitely well prepared before any major storm is going to arrive. So what are major impacts of hurricanes that we worry about in general, in particular for our private well systems? Worry about wind, power outages, and rain and flooding. Let's look at these a little bit more closely. In terms of wind damage, high winds can carry large debris that can land on surfaces, loosen well hardware, dislodge well construction materials, or distort casing. So wind can definitely damage your private well system. Second major impact of hurricanes, and it has to do with winds, is that with the winds, we usually tend to have a lot of power outages. And these can be short-term, or they have been in the state of Florida as long as 3 weeks after a major impact. So it's important to remember that a well pump will, of course, not work when the power goes out. If you lose power, make sure that you turn off your pump at the circuit breaker and leave it off during the entire duration of the storm. It's important to keep sufficient potable water on hand for drinking and cooking in case your well pump goes out during the storm. So in terms of preparing an emergency water supply, how much water is enough? It is recommended to have at least 1 to 1.5 gallons stored per person per day. It's important to increase the amount stored if there are any children, sick people, and or nursing mothers in the home. Don't forget your pets. If you have pets, store at least 1/4 to 1 gallon per pet per day, and this of course depends on its size. You should store at least a minimum 3 days supply of water before a storm. This can add up to a lot of water, and so if you have the space for it and the containers for it, do consider storing a 2-week supply. Here's an example of how much water this can mean. So for a family of 4, where you're storing at least 1.5 gallons per person per day for 3 days, that equates to 18 gallons of water. A family of 4 people with 2 medium or larger dogs, that equates, you can see here, over the course of 3 days to a total of 24 gallons. So I mentioned before that this can end up being a large amount of water, and you need to have a place to store this. Rather than relying on single-gallon jugs or water bottles before a storm comes, you can consider buying a larger food-grade container like a 5-gallon jug that you can fill and store for each person in the house. In case of a power outage, it's good to know that many well pumps actually operate on a 240-volt circuit. So if you plan to use a generator to run your well pump, especially if you have an extended period of power outage, then have the connections established by a licensed electrician. Electricity can be very dangerous, as we all know. So you really need a professional to install these proper connections. If the well was flooded or went underwater, it's submerged, do not turn the equipment on until the wiring system has dried out and has been checked by a qualified electrician. Remember, again, water and electricity simply don't mix, and they're very dangerous together. If the pump's control box was submerged or damaged during a flood or any other type of storm, all electrical components have to be dry before electrical service can be restored. You should get assistance in turning the pump on from a well or pump contractor to ensure that everything then can work properly. All pumps and their electrical components can also be damaged by sediment and flood water. So that's soil, the mud that can move around during a heavy storm and during heavy floods. The pump will need to be cleaned of silt and sand because if pumps are not cleaned and properly lubricated, they can burn out. Get assistance again from a well or pump contractor who will be able to clean and repair different types of pumps.
Thank you, Andrea. So now let's look at the impacts of excessive rain and flooding. Flooding places your private wells in danger of contamination from pollutants found in flood waters and especially at risk of bacterial contamination. If you are unsure if the well was flooded, assume that it was and use another water source until the water supply is disinfected. What should you do if your private well is flooded? The only way to know if your well water is contaminated or not is to test it. We suggest using a certified water testing lab to have your water tested. You can find a list of certified labs on the Florida Department of Health website. We have included the direct link in the end of this presentation. Before receiving your test results, be sure to use alternative safe water sources, such as bottled water for drinking, making beverages, cooking, and also do not forget some like brushing your teeth, washing your dishes, and even washing areas of skin that have been cut or injured. So what should you have your water tested for? In the Private 101 webinar, we talk about EPA Safe Drinking Water Act and how private well users can use these standards as a reference. We highly recommend you to watch the recording if you have not done so. You can find the link to the webinar in the description. A quick recap, there are two categories of drinking water standards, primary and secondary. Primary standards regulate these contaminants that pose a health risk. Secondary standards regulate contaminants that cause offensive taste, odor, color, or sometimes even just foaming and stain in drinking water. They are not forced because they are not considered to pose a risk to human health at recommended level. Flooding places your private well in danger of contamination from pollutants in floodwaters. In 2017, we collaborated with Virginia Tech and conducted a statewide well water quality screening after Hurricane Irma. We collected water samples and sent to Virginia Tech. Virginia Tech analyzed the water quality, including bacteria and 11 organic analytes. As shown in this graph, coliform bacteria and E. coli were found in most wells. At least we recommend bacterial test if your well is flooded. Where can you have your well water tested? A certified water testing lab is suggested. As I mentioned earlier, you can find a list of certified water testing laboratories on the Florida Department of Health website. We have included a direct link in the end of this presentation. Before you receive your water testing results, be sure to use alternative water sources. As I mentioned earlier, you can also bring your well water to rolling boil for at least 1 minute to kill bacteria. Please note that boiling water can only kill bacteria. It cannot remove inorganic contaminants. What should you do if your well water testing reveals bacteria contamination? If your water testing results reveal bacteria contamination, your well and well system must be disinfected. It includes all the household plumbing and water heater, which tend to be forgotten. If you have water treatment systems or devices, you need to remove all the membranes, cartridges, and the filters, and replace them after disinfection process is completed. Before disinfecting your well, be sure to check the sell-by date because bleach loses strength in its container over time. If you cannot purchase a new container of bleach, try to use bleach that is less than 3 months old. And when you choose the bleach, non-scented bleach is preferred to avoid added unneeded chemicals to the well. To make sure the disinfection procedure to be more effective, make sure the pH of your water is between 6.5 and 7. If the pH of your well is not in this range, consult a well treatment professional to adjust the pH and maintain it in the correct range during the disinfection process. The process to disinfect your well is called shock chlorination disinfection. You can do it yourself or hire a professional to do it. Here outlines the basic steps of shock chlorination disinfection. First, pump out the well to remove any potential contaminants. If you know your well volume, then make sure pump out at least 3 well volumes of water from a faucet near the wellhead. If you do not know your well volume, then pump the water for at least an hour. After you pump out the well, do not forget household plumbing. Make sure water is clear and free of sediment. The next step is to turn off the electrical power to the pump and remove the well cap. Prepare a solution of bleach and water and pour the solution into the top of the well. The amount of bleach needed depends on the depth of the water in the well and the diameter of the well casing. So it is also important to know the basics of your well, as how deep it is, how deep the water level is, how deep the well casing is, and what's the diameter of your well. And the bleach should be diluted with 10 parts of water. For example, 1 cup of bleach, you need 10 cups of water to prepare this solution before pouring into your well. And this is the ratio suggested by the Florida Department of Health. So let's look at table. Just take example of your well is 100 feet deep and the diameter is 2 inches. So you need 1 cup of bleach mixed with 10 cups of water. And if your well is 115 feet deep and 4 inches in diameter, then you need 4 cups of bleach mixed with 40 cups of water. So this is the ratio for you when you do the shock chlorination process. After you pour the solution into your well, recirculate the water by connecting a hose to a faucet and spray the water back into the well for at least 10 minutes. After that, you need to open every faucet in the system and let the water run until you can smell chlorine in your water. Then close all the faucets and seal the top of the well. You want to leave the chlorinated water in the system for at least 12 hours, but no longer than 24 hours. During the shock chlorination process, try your best to eliminate or reduce the water use, such as flushing the toilets. Usually people like to do shock chlorination in late afternoon and the next day morning flush out the well water flush out the water by turning on all the faucets, beginning with the outside and flushing out the water until there is no chlorine odor. So when you flush the system, the shock chlorination process is not complete yet. You still need to test the water, make sure there's no bacteria contamination. And it is suggested to test your water after 5 to 10 days of shock chlorination. If bacteria are still present, you may need to repeat the process to remove long-established bacteria colonies. If the problem persists, you need to contact a water treatment professional familiar with bacteria contamination in wells. So here is this is the steps how to do shock chlorination disinfection. And this slide lists the links to the resources that we mentioned during the webinar. With that, thank you for your time. If you have any questions, please do not hesitate to reach out to us. Thank you.